The topic for today's discussion is interpretation of LFTs and liver biochemistry. LFTs denotes liver function test. L for liver, F for function, and TS for tests. Liver function tests. It mainly include albumin and prothrombin time and APTT. The liver biochemistry include ALP, ALT, AST, and GGT. ALT is also called SGPT and AST is called SGOT. First of all, liver biochemistry. The main four things which we just told about ALP, AST, ALT, and GGT. These are the normal ranges. The normal range for ALT and AST is 5 to 35 for both. For ALP, it is 30 to 150 units per liter, and for GGT, it is 9 to 48 units per liter. Now, when there is some pathology in the liver parenchyma, the two things which must be raised, are usually raised, are ALT and AST. It shows us about the pathology in the liver parenchyma, while ALP and GGT are mainly for biliary tree, CBD, and all those ducts. ALT and AST are mainly raised in hepatitis, which may be viral hepatitis, alcoholic hepatitis, and certain hepatotoxic drugs. To differentiate between viral hepatitis and alcoholic hepatitis, the difference is that in viral hepatitis, ALT is raised more as compared to AST. Although AST may also be raised, but the thing which is more raised is ALT as compared to AST. While in alcoholic hepatitis, it is the opposite of this. AST is more raised as compared to ALT, because alcohol mainly causes mitochondrial damage, and AST is an mitochondrial enzyme, and it gets released from there. And so in alcoholic hepatitis, AST is more than ALT, almost 2:1. Now, when there is some pathology in the biliary tree, the ALP will be raised. But we have to look for GGT as well, because ALP is also released from placenta and from bone and from small intestine. So when there is an isolated rise in ALP, alkaline phosphatase, it doesn't mean that there is some pathology in the biliary tree. We have to rule out bone pathologies and placenta and small gut pathologies. So when ALP is raised, we have to look for GGT as well. When ALP is raised as well as GGT is raised, it means there is some pathology in the biliary tree. While isolated ALP rise may occur in the other pathology which I just told about. Now we have to give some certain examples. We now know the normal ranges of ALP, AST, ALT, and GGT, and we have to now give certain examples to know whether this is a viral hepatitis, this is an alcoholic hepatitis, or this is due to certain drugs. For example, ALP is 300, GGT is 75, ALT is 30, and AST is 30. So the two enzymes which are raised here is ALP and GGT. ALT and AST are normal, which means there is no pathology in the liver parenchyma. The problem is there in the biliary tree. So there is some problem in the biliary tree. ALP is 100, GGT is 45, and ALT is 300, and AST is 170. So here the two things, ALT and AST, are raised, which means there is some pathology in the liver, while the enzyme which show us the pathology and the biliary tree are normal. ASP is in the normal range, GGT is normal. So mean there is something wrong in the liver pathology. Now to differentiate whether it is viral hepatitis or an alcoholic hepatitis, so here ALT is more raised as compared to AST. 300 is more as compared to 170. So it's most probably a viral hepatitis, which can be acute hepatitis A, acute hepatitis B, or acute hepatitis E. C rarely presents in an acute hepatitis, and D is dependent on B. Example number 3, ALT is 150, AST is 300, ALP is 100, and GGT is 45. These two are normal in range. These two are raised. Now here AST is more raised as compared to ALT. Now we know that when AST is raised as compared to ALT, both may be raised, but AST will be more raised as compared to ALT. So this is most likely an alcoholic hepatitis. Now when all these 4 enzymes are within the normal range, ALP is in normal range, AST is in normal range, ALT is in normal range, and GGT is in normal range, only isolated increase in bilirubin, which the normal range is 3 to 17, in case here it is 42. Isolated increase in bilirubin. This is a sort of scenario called Gilbert syndrome, in which the patient may be quite normal. He will be normal. He will just complain of when I keep on fasting, or I do exercise, or where there is some infection sort of, so my color become pale and yellow. This is most likely an Gilbert syndrome, in which there is a deficiency in certain enzymes in the liver, which cause glucuronization of the bilirubin. This was liver biochemistry. Now we have to liver functions. Liver mainly produce albumin and clotting factors. Clotting factor 2, 7, 9, and 10. And albumin. Now when there is some pathology in the liver and albumin is not produced in the amount which is required, there will be ascites. Ascites mean accumulation of fluid in the peritoneal cavity. There may be pedal edema. There may be anasarca, which mean total body edema. And when there is deficiency or problem in the clotting factors 2, 7, 9, and 10, it will be denoted by deranged coagulation profile. Coagulation profile mean PT and APTT. PT mean prothrombin time, which also certain labs will give you a value in INR, International Normalized Ratio, and APTT. These both are tests which are done in coagulation, and you may say that is coagulation profile. When there is liver pathology and certain clotting factors like 2, 7, 9, and 10 are not formed, then there may be bleeding abnormality, and there may be bleeding, spontaneous bleeding, whether from the nose, which is called epistaxis, or in the urinary tract, or it may present in the form of bleeding per rectum, or from anywhere there may be bleeding. So this mainly, these two things, albumin and PTINR, mainly are liver functions. That's all for today.